Okay guys, so today we will be talking about most dangerous conditions tier list. I know you have watched top 10 most dangerous diseases or top 10 deadliest diseases, top 10 deadliest viruses, infections and stuff, but nobody talks about conditions. I watched them myself since I was a kid and I've always found them interesting, but they were repetitive and I didn't really like that concept. So since I am a med student and here we are centered around medicine, we will be explaining the medical pathway, the pathology behind it, and the physiology of the disease, and we will be focusing more around the conditions. So we will be making a tier list on the conditions. This will also help you in the future as a med student because you will learn about these mechanisms and it shouldn't be pain to study them. It should be fun like this, and it should be a great applicative learning experience so you can relate it to real life, because when you're learning PowerPoints and presentations, you don't really have the grasp on how this impacts day-to-day life, how this impacts our society. We focused around conditions, so this video will not be repetitive, and we focused on the deadliest of them, so yeah, enjoy. There are a large variety of conditions, from genetic conditions, from septic shock, bacterial infections, cancer, viruses, and many more, and misfolded proteins, for example. So let's start. Fibrodysplasia ossificans progressiva, or FOP. It is an autosomal dominant genetic disorder of connective tissue. So the connective tissue gets transformed into bone. It is caused by a mutation in the ACVR1 gene, specifically the RR206H mutation. This gene encodes the ALK2 receptor, which is involved in the bone morphogenetic protein, or BMP signaling pathway. So what this does is it turns the collagen into bone. So progressive damage will turn that part into a bony region. Excuse my English if you may, because I am not English is not my first language, so it is a bit harder for me to express myself, but I will try to improve. Normally, this receptor turns on only when needed to build bone, but when the body detects inflammation, let's explain this in a more detailed way. So from now on, you will see a relationship between inflammation and disease. Usually, disease causes inflammation, but inflammation can cause disease too if the genetic pathways are affected, which is the case in FOP. So, in FOP patients, the mutation makes the receptor hyperactive. When the body detects inflammation from a bruise, from a heat, from even a common cold, for say, the immune system's lymphocytes rush to the area. Instead of healing the tissue with scar tissue or muscle fiber, the overactive ALK2 receptors signals the stromal cells to differentiate into osteoblasts, or bone cells. The osteoblasts are the bone cells and osteoclasts are the one who resorb the bone. So basically what this disease causes is bone production from inflammation. So if you get inflammation, you will create bone in that inflamed area. This can cause a plethora of problems, from calcified lymph nodes, but the main issue here, of course, is the creation of bone, which will calcify everything in your body, will make it hard and rigid, and that is a problem for the ribs and sternum because the expansion space is limited. So this results in heterotrophic ossification. It kills by thoracic insufficiency syndrome, where the lungs cannot take in enough oxygen, leading to heart failure and respiratory failure, which will in turn lead to death. What I have seen that struck a bit of curiosity in me is that recently there have been cases of FOP where people lived to 56 years. Generally, they live to 40. I don't know if that was an outlier or a biostatistical outlier, or it was something else. But time will tell the difference. In our tier list, we will rank them based on danger. That means the likelihood of contracting this disease or condition. We will be ranking on fatality rate and on life expectancy after you contracted this disease. So FOP is not dangerous at all. 800 people infected, not really infected, but affected by this worldwide is abysmally low. It's very low. So we can't give that more than a 1. For fatality rate, it is always fatal, invariably fatal, so it gets a 10. But for life expectancy, it has a life expectancy of 40 years, up to 56, as we discussed. So this goes into C tier. Up next, Huntington's disease. It is an autosomal dominant neurodegenerative disorder. Some describe Huntington's disease as having Parkinson's and Alzheimer's at the same time. Quite a fast neurodegenerative disease, and it is caused by a CAG trinucleotide repeat expansion in the HTT gene on chromosome 4. Normal humans have 10 to 35 repeats, but in Huntington's there are 36 or more. This DNA error produces a mutant form of the protein huntingtin, which is mHTT. This mutant protein is sticky and it misfolds, aggregating inside neurons. This is similar to beta amyloidosis, which causes Alzheimer's disease, but in amyloidosis, the problem are the chaperone proteins. What they do is they overwatch the folding of the proteins. So the proteins are beta folded, which keeps their structures and keeps them from aggregating. These aggregates are toxic specifically to the medium spine neurons in the striatum. This will cause atrophy as the specific neurons die, the brain physically shrinks, the ventricles enlarge to fill the void, the loss of inhibitory neurons results in hallmark chorea, or involuntary jerking movements, and the usual signs of meningitis, brain abscesses, brain tumors, which is auditory issues, visual disturbances, loss of equilibrium, difficulty of speech or to understand speech. The patient eventually loses autonomic control, and that is usually due to aspiration pneumonia, due to loss of coordination while swallowing, which will cause aspiration because fluid will go into the lungs. This is a bit more prevalent than FOP, but it is not very prevalent. It is always fatal, invariably fatal, and the life expectancy is not as big as in FOP, but it is 15 to 20 years, so we will put it in C tier. Next up is disseminated intravascular coagulation. So this is a condition which results from previous illness like metastatic cancer or septic shock or heart conditions, heart issues. So it is generally a complication, and it is caused by the widespread release of tissue factor, or TF. So tissue factor activates the extrinsic coagulation cascade uncontrollably. Thrombin is generated in massive amounts, turning fibrinogen into fibrin. This creates millions of microclots in the capillaries of the kidneys, liver, and brain, causing ischemic organ failure. For example, the image I have here is of Dick, which is a quite funny short name, nickname, in the glomerules or in the kidney. Okay, so the body consumes platelets and clotting factors, factor 5, factor 8, and fibrinogen faster than the liver can make them. Simultaneously, the body tries to break down the clots through fibrinolysis, releasing fibrin degradation products, or FDPs, which act as anticoagulants. The blood loses the ability to clot entirely. So, as you can see, it can have two phases, which is one thrombotic and two hemorrhagic. So it is important to differentiate between these two because you need to know how to treat them. Because if the patient has hemorrhagic type of DIC and you administer anticoagulants, this will kill them even faster. It leads to multi-organ failure, which kills due to the clots, combined with massive internal and external hemorrhaging after the clots are formed. So you can bleed through the eyes, you can bleed the gums, you can bleed through any open sites, mucosa, and so forth. This condition can happen to everybody, and it is quite common in the elderly who have cancer, who have septic shock, systemic inflammation of that sort. So for danger, I would give it an 8 because we could have them, okay? They're not that rare, and most of the conditions here are very rare or rare, and this one isn't. So yeah, it gets an 8. For death rate, it gets a 9.5 because it is fatal in approximately 70% of the cases. It is a highly fatal condition, and it is very hard to treat because it is caused by other conditions which took over and put the body through a crisis. So life expectancy is very short, and from the time of the onset to the time of death, it can take as little as few hours or even half an hour. So for this reason, DIC goes straight into S tier. Up next we have pancreatic cancer. These tumors are unique because they create a thick scar-like shell around themselves, which is called desmoplasia. This dense tissue creates high pressure inside the tumor, collapsing blood vessels. So it's not only because of this, it can be of ulcerative nature as well, but that is the main problem, that it collapses the blood vessels, it creates necrosis, the enzymes also flood the pancreas, but acute pancreatitis, depending on the condition that has caused it, can be treated. It is highly fatal too, but depending on what condition it was caused by, it can be treated. For example, if it is of bacterial nature, it can be treated. When it comes to cancers, the problem with cancers is that they are fast, they replicate, and they cannot be stopped. It doesn't respond well to chemotherapy, it doesn't respond well to radiotherapy because of this scar shell. And by the time it is discovered, it has mostly metastasized to other parts of the body, so that's a huge issue. If the tumor is located at the head of the pancreas, it wraps around the superior mesenteric artery and the portal vein, which makes surgical removal impossible in most cases because those arteries are large in caliber and are highly important. So it is rather preferred not to intervene on them because the risks associated with an intervention on those arteries far outweighs the benefits. So it's almost guaranteed death, basically. And if the pressure increases at the portal vein and at the hepatic level, you will start having esophageal varice or varices, which are dilations of the blood vessels within the esophagus that can cause extensive bleeding, can cause hemorrhagic shock, and I have seen a patient with esophageal varices, and the amount of blood that the patient was vomiting was insane. He filled like 3 500 milliliter bags. It was bad, and it took a while to be stopped and stabilized, The patient was elderly and was having coagulation issues and had I don't know if he had adenocarcinoma at the hepatocellular level, or he had some portal vein issue like pancreatic cancer, but he had something that was similar, located in the abdominal cavity, which led to the esophageal varices, and he was bleeding profusely. And I've saw an intervention where they sealed those varices off. So varices in the stomach and varices in the esophagus can mean pancreatic cancer, and it's not that common to be pancreatic cancer because it can be cirrhosis, it can be adenocarcinoma of the liver. So for prevalence, it is quite prevalent like all cancers, but it comes with old age in most cases. It comes due to smoking, due to alcohol, primarily due to genetic predispositions and late mutations, due to repeated inflammation and all this stuff. So for danger, I'd give it a 5. For fatality rate, a 9.5. And for life expectancy, the life expectancy is pretty grim. It's under 15% for 5 years. So in this case, I will put this into B tier. Up next, we have septic shock. Now, septic shock is a condition caused by systemic inflammation and a so-called cytokine storm when there is a generalized infestation or infection in the bloodstream. There are many pro-inflammatory cytokines and many run together. So for example, if you have psoriasis, which is an autoimmune condition which affects the skin of the scalp and face primarily, but can also extend to knees and elbows and palms, and it depends if it becomes pustulated or generalized, or it depends on the complications. But what I'm trying to say is that those release pro-inflammatory cytokines, IL-12, IL-23, IL-17, tumor necrosis factor alpha, and interferon gamma. Those are common with the arthritis inflammatory pathway too. So the release of those pro-inflammatory cytokines can cause arthritis if the autoimmune response gets bad enough and is not treated. This can be treated with monoclonal therapies, but we're extending the topic of this video, so I will make another video if you want about that. But in this case, interleukin 1, tumor necrosis factor alpha, interleukin 6, 2, 3, 5. 5 is mostly in allergies. So 1, 2, 6, 11, 10, they release into the bloodstream and cause systemic inflammation. So the mechanism through which inflammation works is vasodilation and vasoconstriction around the affected area, so that the pathogen cannot spread and the inflammation remains localized. But when it is systemized like this, vasodilation occurs throughout the entire body, and you basically get one huge edema. Generally, it leads to massive blood loss, fluid loss. So plasma will leak out of the bloodstream and the blood pressure will drop drastically, and it causes death through heart failure. Danger of septic shock is quite interesting because you wouldn't expect to get septic shock, but in some cases you can get it from dental abscesses, so from unresolved dental infections. You can get that from otitis. You can get it from many infections and opportunistic infections like candida, for example, but you have to be immunodepressed to get into septic shock most of the times, but sometimes it happens even if you are not immunodepressed and some bacteria gets into your bloodstream via some cuts or bruises or stuff like that. So always disinfect your wounds. It gets a 6 for danger. For fatality rate, it has a 30 to 50% fatality rate, so it gets a 7. For life expectancy, I think it's not as bad as in DIC, but it is still bad in most cases. It depends on case to case, it depends on how the body reacts to certain medications, it depends on the state of the patient, if they are old or not. So it's not that independent as it is in the IC, because in the IC it doesn't matter as much the condition of the patient if they are young or old as it matters in septic shock. So it can be anywhere from hours to days. For this reason it goes into C tier. Okay, so Huntington's disease is worse than FOP and septic shock is worse than Huntington's disease. Imagine if into C tier there are diseases with 50 to 100% mortality rate. What a tier list, right? Okay, so next up we have glioblastoma multiforme. So this is an astrocytoma. The astrocytomas have different levels. It can be benign at first grade, second grade it is benign with malignant inclusions, third grade is malignant, and fourth grade is glioblastoma, which is the most aggressive type of brain tumor. Now, this brain tumor is very, very scary, and I had the opportunity to see this in a formaldehyde jar. It was very scary. The necrosis was worse than in this image that you see here. It perforated all the way through the corpus callosum, and it looked like it was greening. It was so weird and so scary that something like that could even happen. Glioblastoma multiforme shows pseudopalisading necrosis. This means that the tumor grows so fast it outgrows its own blood supply. So, in general, tumors need to have angiogenesis. Angiogenesis is the formation of new blood vessels which supply it with nutrients. This tumor specifically grows so fast that it cannot grow blood vessels as fast as it replicates. So the center of the tumor will die, and that will be the factor that creates the necrosis, as seen the liquefying necrosis, because the brain undergoes liquefying necrosis. And the living cancer cells will spread around the dead zone. The tumor cells will migrate along the white matter tracts of the brain, and by the time the main tumor is visible on MRI, microscopic cells have almost certainly already crossed the corpus callosum to the other hemisphere, creating a butterfly glioma. The tumor releases VEGF, or vascular endothelial growth factor, which creates leaky abnormal blood vessels that disrupt the blood-brain barrier, causing massive cerebral edema or brain swelling. The growing mass and swelling due to hypertension will herniate and crush the brainstem and can affect the centers within the medulla oblongata, which are related to breathing and cardiac function, which will either cause cardiac arrest or will stop your breathing. So what's scary in this disease is that in any given day you could just pass out, or you could just have slurred speech or have an episode of dissociation, which generally can happen in normal people too if the stress is high enough or stuff like that. But it's similar to other symptoms, like if you spend all day staring at the PC and you see flashing lights, it is quite normal, okay? But it can also be due to glioblastoma, or you have a nosebleed, or you start to hear some things, or tinnitus even. which you will not pay attention to. And then around 2 to 3 weeks later, you will pass out randomly or get a nosebleed and then pass out. And then you will find out that you have a brain tumor, and that brain tumor is glioblastoma. And the thought of that would make you go insane, because this tumor is so deadly. It's deadly in almost 100% of cases, because generally these are very deadly. They're basically 100% deadly, and they're so fast that even with treatment, with surgery, with chemotherapy, with radiotherapy is not very often used because it requires a specific mask which targets the radiation in the areas needed, and even so it affects the brain, and chemotherapy affects the brain terribly. But even with those, the life expectancy is 12 to 15 months. And to add to the shock factor, it typically arises in children, teenagers, and then elderly. Until the 24-year-old mark, you have a chance of getting glioblastoma. Brain cancers are usually common in children because they are the cells that divide in early childhood, and in early teenage years less, but they mostly divide in early childhood, and the embryonary cells can connect up in the teenage years or late adulthood or in the elderly. So for this reason, glioblastoma goes into S tier, and it is the worst. Oops, S tier. Okay. Oh, so up next we have Echinococcus granulosus, or a hydatid cyst. This cyst is caused by parasites, which is quite problematic. Parasites are quite problematic in humans. They can be transmitted through animals, or they can be ingested through undercooked meat, or through water sources, or through other food sources that are raw, for example fish and all that. There are lots of parasites. There are cylindrical parasites. There are protozoa, which are amoeba or unicellular organisms. The hydatid cyst is not very dangerous. It is dangerous, but not quite as dangerous as the others on this list. But if it bursts inside your brain, you will pretty much 100% die. The reported casualty or death rate on a burst hydatid cyst goes from 80 to 100%, which is an understatement in my opinion. It is very close to 100%, and that is because of two main reasons. First is brain herniation due to the increased tension that arises from the burst hydatid cyst, which will cause necrosis, liquefaction necrosis, and will generally affect the brain. It's like a shockwave from an explosion. And the second one is that the liquid inside is not sterile. Why they go to our brain is quite interesting, because humans are accidental intermediate hosts. They're not definitive hosts. So the worm wants to be in a sheep, the worm wants to be in a dog, it doesn't want to be in a human. When a human ingests the eggs, the oncosphere or the larvae hatches in the gut, bores through the intestinal wall and enters the bloodstream, which will probably get to the brain, or it can get to the lungs and give you cysts in the lungs, which will have symptoms related to lung conditions and lung tissue damage. It can also get stuck in the liver and form a cyst there, but those conditions are not as dangerous. Furthermore, in the liver, it is the best place for it to be, if we can call it that, because the liver has regenerative abilities that are far more superior than the lungs or the brain, which the brain doesn't really heal. That's why if you had an aneurysm, we can see it on the MRI, because that place will not heal and will appear a different color, or it will appear after some time. It is harder to differentiate, but you will see that there are no there is no neuronal mass there. Neuronal mass. If it doesn't kill because of the sudden pressure increase, it will due to anaphylaxis. If the cyst ruptures, the sudden release of the cyst fluid into the brain triggers an immediate massive IgE or immunoglobulin E mediated allergic reaction, which will cause an anaphylactic shock. The patient can die within minutes from shock and cerebral edema. I have talked about the mechanism of cerebral edema before, so that is exactly what it does. Or if an edema in general, it is quite easy to be linked to cerebral edema. The same thing happens. The fluid comes out of the bloodstream. The plasma comes out of the bloodstream. As for danger, yes, you can get it, but it is not very dangerous. You can't get it that easily, especially since regulations are in place so that food doesn't contain parasites, especially raw food, and water is also rigorously tested. And even if you get these parasites, they need to migrate to your brain. They can stop in the lungs, they can stop in the liver, and they can be simply expunged without any further issues. For danger, it gets a 4. For fatality rate, it gets a 9.8. And for life expectancy, it gets a 10, because you can die within minutes, basically. So for this reason, it goes into higher A tier. Now up next we have the Ebola virus. This virus is very difficult to deal with and very deadly because this virus is very difficult to deal with and very deadly because the virus encodes proteins VP35 and VP24 that block the body's interferon response. The immune system literally does not know it is infected until the virus has replicated massively. The virus infects monocytes, macrophages, and dendritic cells at first. It then travels to the lymph nodes and spreads to the liver and spleen. So it attacks the lymphatic organs, which are the most important in immune responses. It is quite smart, if I may say that, even if it doesn't have a mind of its own. It looks like it because it attacks the immune system first, almost as if it were to know that it is the only thing that can kill it. The virus eventually infects endothelial cells, the cells which line the blood vessels, detaching them from their base membrane. The integrity of the blood vessels fails, the patient leaks fluid and blood into the tissues. The loss of blood volume leads to hypovolemic shock, which is why this virus kills. As per danger, it is highly subjective as to the area you are residing. So, for example, if you are in America or Europe or Asia, Ebola is not dangerous at all because it is not common at all in those regions. And there was an outbreak in Africa, if I remember well, which brought some infected patients into Europe, but they managed to be quarantined and the virus didn't spread any further. But if you are in Africa, it could be quite dangerous depending on the location you are in. At this point in time, Ebola is under control and is not classified as a pandemic, but who knows what this virus will do and how it will mutate. For now, I will rate it no higher than Echinococcus granulosus, so I will give it a 4. As per fatality rate, it is not always fatal, it depends on treatment. It can vary from 50 to 90%, so it is quite deadly. And as per life expectancy, you get days to weeks, which makes it quite fast. So it gets a 9.5. For lethality, it gets an 8, and it goes into lower B tier. Now we go to the parasites again with a protozoa, or Naegleria fowleri, also known as the brain-eating amoeba. The amoeba enters the nasal cavity and it is attracted by the acetylcholine or neurotransmitter used by the olfactory nerve. It squeezes through the cribriform plate, or the porous bone between the nose and the brain, and climbs the olfactory nerve bundles directly into the olfactory bulbus of the brain. So it is quite hard to get yourself infected with Naegleria fowleri even if the water contains it, and there have been some studies made which have shown that bodies of water are infected with this amoeba, but people didn't get infected with it because you have to be quite unlucky. So the hairs in your nose will not catch this protozoa, and it will go straight to the receptors of the olfactory nerve. So this is how this amoeba will get to your brain and kill you. There has to be a chain of unfortunate events for the amoeba to pass through the hairs of your nose and not get entangled in there or in any other part of the nasal lining, and for it to get straight into the receptors of the olfactory nerve. Unfortunately, once you get it, you will probably die, almost for sure. It uses a structure called an amoebistome or a suction cup-like feeding apparatus to attach to the neurons and consume them. It releases cytolytic enzymes that liquefy brain tissue. The immune system launches a massive attack causing severe inflammation or meningoencephalitis because this call is a clue. What is interesting is that the body kind of causes its own death before the pathogen or condition can cause death itself, because the inflammatory response itself can lead to death in most cases rather than, let's say, your brain is no longer able to perform X functions because it is so affected by this pathogen. As per danger, it is not very dangerous. It gets a 3. There was a case recently, if I remember well, with a Serbian boy that got that allegedly from a pool, I don't know, but the poor guy died, and it just goes to show how deadly this is. So for danger it gets a 3, for fatality rate it gets a 9.8 because it is almost invariably fatal. For life expectancy, the life expectancy is very short. It is around few weeks or few days, on the higher end of days and on the lower end of weeks. So for this reason it goes into A tier. Now we continue with acute radiation syndrome or neurovascular subsyndrome. This concept is based more on physics rather than physiology, but I'll try my best to explain it. So, high energy photons, gamma rays or X-rays strike water molecules in the body, creating free radicals. This is also called the radiolysis of water. These radicals will then smash the sugar phosphate backbone of DNA. The lethal damage is double-strand breaks or DSBs. The cell cannot repair the chromosome and triggers apoptosis or programmed cell deletion. Not to be confused with necrosis, which is not programmed and it is because of various factors. Progressive apoptosis will eventually lead to such extensive DNA damage that you will not recover and not be able to function normally, or if you will get cancer at some point, which will be quite aggressive because the DNA damage is very high. For 2 to 6 gray, bone marrow will die. From 6 to 10 gray, GI tract lining dies, and more than 10 gray, the dose is so high that it damages the vascular endothelium immediately, and fluid will start to leak into your brain, and you guessed it, this is called a cerebral edema. At high doses, the nervous system shuts down before the bone marrow or gut even have time to fail, so it will cause convulsions, ataxia, and coma very rapidly. For danger, it gets a 2 because it is highly situational, and unless there are some nuclear power plants around you or you work in those nuclear power plants, then you will most likely not be affected by radiation in this quantity to be deadly. For death rate, it gets a 10 because it is highly deadly, and once you have passed a certain threshold, it is certainly deadly, invariably fatal. And for the time it takes, for life expectancy, it can take from few weeks to few months, depending on the radiation doses. So with a score of 2, 10, and 10, it goes into lower S tier. By the way, I put it into S tier just because of the potential it has. Because if a nuclear power plant explodes, or let's say we have nukes going off, then the danger increases significantly. Good, now we have Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease is a prion disease, also called transmissible spongiform encephalopathy, or TSE. The disease is caused by the conversion of the normal cellular prion protein, or PRPC, which is alpha helical, into the scrapie form, PRPSC, which is beta sheet rich. So, somewhat close to amyloidosis again. Beta sheet is a form in which proteins can bend to create structures, and the other method of bending is the alpha helical way. I will explain this in another video if there is demand. Prion diseases are self-feeding chains of disaster because the PRPSC acts as a template. When it touches a normal protein, it forces it to snap into the beta sheet shape. These misfolded proteins stack together to form amyloid plaques. These plaques are highly toxic. As I have mentioned before, they cause Alzheimer's. The lysosomes inside the neurons try to digest them but fails because prions are protease resistant. The lysosomes burst, releasing acid and killing the neuron. The process creates microscopic vacuoles or holes in the cortex and cerebellum, turning the brain into a sponge. The automatic nervous system eventually will fail. So for danger, I will give it a 4. The chain reaction of transformation from alpha helical to beta sheet will occur if you eat human brain. That's why some cannibal tribes died because they ate human brains until they found out that that was the killing factor, and they stopped. For fatality rate, it gets a 10 because it is invariably fatal. The chain reaction cannot be stopped whatsoever, and you just die slowly. For life expectancy, it gets a 9 because it takes anywhere from 4 months to a year to die, and it is quite a short one, and one that will affect your life quality a lot. So from those 4 months to 1 year, the amount of life that will be lived to a normal standard will be very short. For this reason, it gets a 9 and it goes into upper S tier. Okay, you've made it to the last one, which is, you guessed it, rabies, which is a virus that looks like the shell of a bullet. And that's what we learned, literally. Rabies is also called Lissa virus, and after a bite, the virus replicates locally in muscle tissue. It then binds to acetylcholine receptors at the neuromuscular junction. This is the horror of rabies. It enters the motor neuron axon and travels retrogradely or backwards up the axon at a speed of 12 to 100 millimeters per day. Because it hides inside the nerves, the antibodies in the blood cannot reach it. It reaches the dorsal root ganglia near the spine, replicates explosively, and ascends to the brain. Inside the brain neurons, it forms eosinophilic inclusion bodies called Negri bodies. These are viral inclusions. Once in the brain, it travels back down to the nerves, to the salivary glands, ensuring the saliva is infectious. It targets the brainstem and limbic system. It causes autonomic dysfunction, cardiac arrhythmia, hydrophobia, which is laryngeal spasms, preventing swallowing and eventual respiratory arrest. As danger, it will get a 7. It is still a problem worldwide, but due to vaccination campaigns, the numbers are slowly decreasing each year. As for fatality rate, it gets a 10. Once symptoms appear, you will almost certainly die. And for life expectancy, it gets a 9.8 because you will die in days to weeks. So for this reason, rabies will take the number 1 spot in S tier.